Hey everybody, how's it going? Want to talk today about base level of care and what I consider to be base level of care, then the next level, which is above base level of care, which is the type of service I try to offer my clients. So base level of care for massage therapists who go and find a hypertonic or tight sore muscle and they release it for no reason. They don't understand why they're releasing it. They're just releasing it because it's tight. A chiropractor who does the same adjustments over and over and over again to his patients. A personal trainer who prescribes either a stretching protocol for clients and really doesn't give them the reason why. It's just this stretching protocol that they've gotten out of the book, and maybe they use it with most of their clients. And even one of my more favorite ones is personal trainers who give everybody the same workout. Doesn't matter what it is. They don't tailor the workout or anything like that. Above or base level of care for a yoga instructor. Base level of care for a yoga instructor would be you go in, you do really fancy poses before people who are ready for those poses. I trained for a year and a half with an Iyengar yoga instructor, and one of the things that I really enjoyed about that practice is it was very basic but very specific, and it was propped, and it was well propped. What I mean by propped is that, let's say I'm sitting in butterfly and I can't sit on my sits bones. So what they would do is they would bolster us up, or they would bolster me up. I would sit on a blanket or a yoga block so that I could get on my sits bones and I could stack my structure on top of each other. Kettlebell instructor. Base level of care with a kettlebell instructor would be someone who has taken a course and hasn't really applied that course to themselves, but they use it with their clients. So above average level of care. Above average level of care would be, as a massage therapist, starting to study your anatomy, starting to understand your kinesiology, starting to understand your corrective exercises. Again, if you're giving a stretching protocol to someone, but you're not really specifically tailoring it to them, or you're just getting it out of a book, and even worse yet, you've never actually done those stretches, that's actually below level average care, in my personal opinion. So above average level of care is someone who starts to research their anatomy, they research their kinesiology, they research their corrective exercises, and they start to put together strategies that address muscles that are overworking and underworking. One of the reasons I love NKT is because it really helps me to do this. And that's true for chiropractors. Instead of, like right now, I have a rib head out that happened in jiu-jitsu a couple weeks ago. So I'm seeing a chiropractor, but I'm also seeing my good friend Elise Lingle up in Fenton, and we're working on my thoracic rotation as it relates to the muscles in my back around that rib head. And now I'm getting adjustments on top of that, so we realign the vertebrae. We realign the vertebrae and the rib head. And what I'm finding is that it's a much more effective methodology. I would love to find a chiropractor that is willing to learn NKT in Michigan. It just hasn't happened yet, except for Jason Ross, and he's out in Grand Rapids, about an hour and a half away. Personal trainer, same thing as a massage therapist, really. You got your anatomy down, you got some of your kinesiology down, but really start to look into correctives. And then also, instead of just giving stretches for no reason, start to understand why they're stretching. Start to understand how to retrain some of those movement patternings. I was just listening to a personal trainer, and she was trying to help her client out, and she was trying to help him out with a hamstring stretch, and she was trying to do it on a bench or a stool. And this gentleman happened to be an older gentleman, and he was having a hard time picking his leg up. Well, maybe, just maybe, it could be because his hip flexors are not working correctly, and in order to compensate for that, his hamstrings are working. Same thing would be true for a yoga instructor. So that's the care that I aim to give to my clients, and that's the care that I seek out. I seek to give out above level of care, and I seek to practice with my clients above level of care because I don't want to be like everybody else. And I don't think that, I think that in today's internet age, 2014, there's this thing called YouTube, there's this thing called the interweb, and that Google thing. You can do a lot of research on stuff, and there's so much available for free. So just want to throw this out there, talk about above level of care and what I feel like it is, and how I use it in my practice. Thanks for watching. We'll talk to you soon, and remember, practice makes improvement.